So Dr. Edwin Williams, a facial board-certified, double board-certified facial plastic surgeon here discussing otoplasty. You know, what is otoplasty? Sometimes you'll hear it as an ear pinning procedure. It's a common procedure for those of us who do and specialize in facial procedures. But basically it's setting the ear back. So let me just tell you a little bit about it. I mean, the ear develops, and it's not really a family thing, but you do tend to see prominent ears, as we call it, run in families. You know, what is it that actually occurs? There are two things. There's this fold here called the antihelical fold, and some people that just doesn't develop, so that's flat. And then we have some people who have what's called an overly developed, this area, concho bowl. And I would say probably in 50–60% of our patients, they have a combination of both, so that their ears kind of stick way out. How do you correct it? You address, again, you customize the procedure to the individual. And sometimes, in fact most times, patients will have one ear that's more prominent than the other ear, and obviously we take that into consideration when we're fixing them. What is the best age to do this? Well, we typically will do them, as you can see in the boy in this video, at about the age 4 and 5, because the ear is about 90% of its growth size, adult growth size, and it doesn't grow a lot more after that. So the ideal age before kids start to get picked on in school is about the age 4 and 5. They start to develop a body image at 3, and they become more aware that they're a little different, and you know, you want to avoid the ridicule and that type of thing. The other time we'll see patients is many times we'll have young girls or even patients who are a little older in their teenage years, and we can actually do that under local anesthesia. The anesthesia we do use typically is a general anesthesia for children, and it lasts about an hour a year, so I usually book an hour and a half to 2 hours. It's done as an outpatient. I must say it's one of the more gratifying things that we do. It really makes a big difference in the way kids feel about themselves. You can check out some of our before and after photographs, but again, the ideal age is about age 4 or 5. Afterwards, I usually, we have a kind of a head wrap that stays on for a couple of days, and then we ask the patients to wear a ski band, headband, at night for 6 weeks. So I hope this answers your questions on otoplasty, or the ear pinning procedure that is typically performed either in kids or someone who's a teenager, or sometimes even adults.